Welcome back to the show. Let's begin this morning as advertised on line number one. Second morning to the President of the Registered Nurses Union of Newfoundland and Labrador. That's Yvette Coffey. Yvette, you're on the air.
Good morning, Paddy.
Before we get into the story regarding the number of nurses hurt on the job, what do you think when you hear stories like the Premier and his recruitment team making their way to the United Emirates in Dubai? Because there's a huge focus on recruitment.
There has been a huge focus on recruitment and not enough on retention, in our opinion. We lost 333 nurses out of the system last year. The minister says we recruited 400, yet our vacancy numbers changed by 15, with a net of 15. So if we're losing just as many as we're bringing in, that is an issue. That's where our focus has to be, is on retaining the ones that we have in the system and retaining those we're bringing into the system.
Okay, I suppose there's got to be a way to find some sort of balance between the two. But in the world of recruitment, for instance, my thoughts, and yours are more important because you're actually working in the field. So you bring in more recruited registered nurses or licensed practical nurses, and consequently some of the issues regarding retention and the attitude in the workplace, maybe the reduction of the reliance on travel nurses, easing up the ability to, have shorter shifts, maybe being able to access vacation days. So where does that balance lie? What needs to be added to the recruiting efforts in addition to what is going to have to necessarily be some recruitment abroad or domestically?
Well, the government did workforce research with us last year, prior to our bargaining, actually, looking at the trends and looking at what registered nurses and nurse practitioners particularly wanted out of the workplace. Some of the barriers to accepting full-time jobs was childcare. So there are some childcare initiatives announced, upwards of 150 extra seats for healthcare workers. However, that hasn't come to fruition yet, and that's going to take some time. We also said that flexible scheduling, self-scheduling. Well, already I'm in discussions with NL Health Services where, they're not happy with self-scheduling, and I'm looking at them and saying, if that's what it takes to keep a registered nurse in the system or to take a job, that's what you're going to have to do. And we did get it in our collective agreement already. It's that day-to-day stuff of having to fight for everything on the ground. We're having issues around some of the stuff we negotiated in the collective agreement and whether or not people are eligible for it if they have a sick day or an unpaid sick day. And that does not show respect for registered nurses. And to be quite frank, they're not very happy. And that goes to the retention. It's that on-the-ground stuff. I can't get a day off. I can't self-schedule. I can't work around my children. I'm casual because I have my husband is away working or my partner is away working. I can only offer you shifts while that person is away as a casual. No, unless you can commit to 900 hours, we're not taking you. Where our collective agreement gives them that clause where they can do that. So it's that on-the-ground stuff, and incentives have been announced for retention of nurse practitioners and family care teams. I don't think they've all gotten that yet, and that's almost a year that was announced. So announcing stuff for retention but not following through on it in the workplace is causing major angst for us as well.
I don't know if you heard the comments from Minister Osborne when we had him on the programme last week to talk about the use of travel nurses and saying, people call them a necessary evil, which I'm sure doesn't ring very well inside the ears of those who are working as travel nurses. And, talking about things like conflict of interest contracts and, the inability, if I leave the public system, to go to a travel nurse agency, I can't come back. But that doesn't mean that, we've got any real pragmatic focus on how we phase them out. In other provinces, they've got timelines. So what did you make of how the minister spoke about the travel nurses?
Well, I had to agree with him that at one point, we were looking at our members not getting annual leave, and that was 2 summers ago. It has grown into reliance on travel agency nurses. And to be quite frank, I think all of this, the privatization of nursing with travel agencies, farming out other things out of our publicly funded healthcare system throughout this country, and I'm here in Ottawa at national meetings, actually. So here in this country, what we're seeing is the use of travel agencies, the privatization of healthcare, and we've been calling on our government to say no to privatization the more we're privatizing, the more we're losing people out of the publicly funded healthcare system. And if continue to lose the nurses, which we are, I mean, they're graduating and they're like, I think I'll go do travel. I got more flexibility, I get time off, and it's more pay. It's very attractive for new graduates coming out compared to, our collective agreement and wages and the work-life balance. And we have been making strides in the workplace. I can't just say it's all bad. We have been making strides, getting the self-scheduling, the new collective agreement, but there's a lot of work to be done on recruitment, and the focus cannot always be on or focus on retention. Focus can't always be on recruiting. It's no good to recruit someone from India if we're not going to treat them right, give them the right supports. The housing issue is another big issue in this province when it comes, even our travel locums going up to Labrador, having issues with housing. We've been discussing that. It's all those things that, that lend toward retention of healthcare workers.
Yeah, and if we add 400 nurses but we lose 330, we're only chipping away at a huge vacancy which stands somewhere around the neighbourhood of 760. Yvette, let's move off to the story regarding the numbers of nurses that are hurt and reporting their injuries to Workplace NL. For starters, can you help us break it down? What percentage of these injuries, and it hovers around 400 per year. The high water mark was in 2018 when there was 450 nurse-filed injury reports, and that only captures those who file. Some might be hesitant to file because of losing some of their pay when they're on comp, but can you help us break it down about what percentage of those injuries are caused by violence?
So, the healthcare sector itself, which includes personal care homes, home care, child use family services, has a 3.9% higher incidence of violence than all the other sectors, work sectors in this province. So we have an issue here. And the injury rate for like PCAs, then LPNs, then RNs, that's the way it goes for the number. And if RNs are filing a workers' comp claim every second day here in this province, that means the LPNs are filing them daily or more than daily, and the PCAs as well. We have an issue with violence. And yes, since 2019, we have been calling for something to address the violence in healthcare. And I'm still fighting for a health sector safety council after being talking about it for the past 3 years in particular.
Yeah, and you compare it to things like the Fish Harvester Sector Safety Council, the Forestry Sector Safety Council. How would a healthcare safety council work when it comes to things like violence? Because there's going to be some potential soft tissue injuries just based on trying to move or to lift patients and those types of things which are part of the job, unfortunately. So how would this independent safety council work if you had the druthers to set it up?
Well, it would be an independent council, independent of NL Health Services and Workplace NL. There will be injury prevention. One of the things we've asked for is a focus on addressing violence and come up with strategies. So in 2019, when we had a forum on violence, we brought all stakeholders together, including the RNC, the RCMP, the health authorities at the time. And, one of the things we talked about is not having support. So registered nurses don't have the support, and they still don't to this day, from police forces and management to actually charge someone with assault. Because what they're hearing is, you can charge them, but nothing's going to come out of it. That's not what our nurses need in the workplace. They need the support of our police forces. They need support of our employers. Because if you go into Walmart and you're impaired, either through drugs or alcohol, and you assault someone, you're charged, and there's no question about whether you've been under the influence. But yes, everyone thinks it's okay to do that in healthcare. That's not on for me, and it's not on for registered nurses or other healthcare workers. And that's the type of thing we need addressed. Yeah,
and nor should it be. I appreciate the time. This is a very quick email from someone who was a former nurse now. I left my job as a nurse simply because I could not get a single day off. I always showed up. I never called in sick. But when I asked for a day off, I was denied consistently. After 6 months of asking, I resigned. I was a senior nurse of over 30 years. So those stories I don't think are the exception. They're becoming part of the rule. Anything else you'd like to offer this morning, Yvette, before we let you go to your meetings?
Well, one of the other things about health sector safety councils is that if you look at pilots and truckers and there's other professions who have a limit on how long they can work, the excessive hours of continuous work, they have a profound impact on the nurse fatigue. It is equivalent to someone being impaired, and we end up with long-term health risks such as high blood pressure, heart disease, diabetes. And then we look at the new study that just came out about healthcare safety incidents, where 1 in 17 patients had an adverse side effect during their hospital stay in the past couple of years. 1 in 17. And then you equate that to the long hours that registered nurses, nurse practitioners, and other nursing professionals are working. It's not hard to equate the evidence and to say we've got to do better on retention. We've got to do better on limiting the hours that nurses can work. They're still doing 24 hours in our system. And that's not on, and that's not safe for either the nurse or the patient.
No, it's not. Obviously not. A very quick one before I let you go. So with the reinstatement of mandatory masking in the healthcare setting, do you or your members have any issues with the reinstatement of the policy and or how it's going to be enforced? Have you been given any guidance about how it's going to be enforced?
No, I haven't had any discussions with NL Health Services on it, but given the high incidence of respiratory infections, COVID highlighted for us the risk associated with these types of infections. But we're not just seeing COVID now, we're seeing influenzas. And we just encourage our members, continue to do your point of care risk assessment and assess whether or not, what kind of protection you need. But it's not just about protecting ourselves, it's about protecting our patients. And we do encourage the public to also do what they feel is necessary to protect themselves and to protect their loved ones or their family or friends.
Appreciate your time, Yvette. Thanks for doing it.
Thank you.
You're welcome. Bye-bye.
Bye.
Yvette Coffey is the president of the Registered Nurses Union. Let's take a break.